Diane Atwood is with us again, the author of a blog, Catching Health, and today she is telling us about a man who's suffering from cancer who has some advice for other people going through something similar. And I don't know, advice almost seems like too shallow of a word or something.
Right.
It's very, it's a lot of wisdom, it's a lot of insight, and it's almost a roadmap to getting through cancer.
It's a top 10 list.
Yeah.
Letterman style, he says. You start from 10 and you work down. So yes, today I'm going to introduce you to who I think is a remarkable man. His name is Dr. Joe Semmes. He's on sabbatical right now, but he was an emergency medicine physician at Mercy Hospital, and he was also director of research at True North Health Center in Falmouth. So Joe was diagnosed with pancreatic cancer at the age of 46 back in 1996. And most of the time when we hear that somebody has cancer of the pancreas, we think shortened lifespan.
Right.
But he's got a rare type of pancreatic cancer. It is called PNET, which stands for pancreatic neuroendocrine tumors.
Okay.
I got that right. So Joe describes his life since his diagnosis as dancing the dance with cancer. And when I got to know him about 2 years ago, he was going through a really rough time and did not think he was going to make it. And during that time, he came up with this top 10 list for seriously ill cancer patients, for anybody who's seriously ill. And I believe he follows his own advice, and it's helped him to get through more than one rough time. And you can read more about Joe and his dance with cancer, and you can watch a video of him going down his top 10 list, 10 to 1. And two other News Center alumni, Pete Smith and Barry Atwood of Smith Atwood Video Services, produced the video as a gift to Joe and the Cancer Community Center.
Okay.
And just go to catchinghealth.com and you will see Joe's picture and his story right on the homepage. But I am going to give you a sample. I'm going to tell you what number 10 is. Remember, he's a man with cancer and he's also a doctor. So 10, market yourself. You want your health care providers to connect with you human to human, to know your story, not just your disease process, and learn a little bit about their story as well. Wear clean clothes. A hospital gown not only looks pitiful, it feels pitiful. Make eye contact and learn the names of every single person who's involved in your care.
So make that human connection.
Absolutely.
So that you're just not another patient with a disease.
Right, not just
list.
some guy in a half-open Johnny lying in a hospital bed.
Right.
So you can go to catchinghealth.com again, and you can watch the video and learn more about Joe. And please share the post, because the people who have been very grateful to have done that.
It sounds like it could be very helpful to some people.
Absolutely. And while you're on the blog, please sign up for my monthly newsletter. And also, you can like the Catching Health Facebook page. Everything's right there on the homepage off the website.
Very good. Thanks, Diane,
Thank
very
you.
much. We'll be right back after this with a recap of the morning's top stories.